while I've got the house to myself, I want to say I'm very sorry that I haven't been on much. I know I posted a video yesterday. That's one I taped a few nights ago, because I'm having to do videos really late at night, because the kids are always around, with it being school holiday, or somebody will come knocking at the door and the dogs will start. And at the moment, my eldest has took her two younger siblings out to get a couple of birthday cards and stuff for their friends, because they're going to parties tomorrow. So I thought I would take the opportunity to come on and talk to you guys about gastroparesis, because it is gastroparesis month, and I just wanted to talk to you guys about something that not just affects those with gastroparesis, but basically affects every single person on the planet. And I am literally sure that every single person on the planet has had an issue with a doctor surrounding it as well. So yes, it is Gastroparesis Awareness Month, and if you want to know more about gastroparesis, then I will give you an overview. So gastroparesis basically means that one's stomach is paralysed and doesn't digest food, and it doesn't allow that food to pass through as the way it should. Now, most people can have gastroparesis for unknown reasons, whether it be, or they can have it because they have a connective tissue disorder like Ehlers-Danlos syndrome, whether they have diabetes, damage to the vagus nerve, or just for no reason whatsoever, they can just develop it. But every single person with gastroparesis is different. Not every person with gastroparesis will need a feeding tube. Sometimes they will find something that will work, whether it be a dietary change, whether it be a dietary texture change, whether it be a prokinetic or an antiemetic medication, or anything like that. Basically, they will find something that will help. But you get the odd few, like myself, that has tried everything they could possibly try, even those that have fell into an amber category for other health conditions that they have, and they still haven't been able to have any success with helping them eat food. And that's when things more invasive are wanted, which is things like feeding tubes. Now, if you want to know how a gastric emptying study is done, you can go and watch a previous video, which I will try and link below. However, I'm not going to discuss how it's done today. But the average person without gastroparesis will likely digest food around within 2 hours. And the amount of food that they give you for a gastric emptying study is usually very minimal. So they'll give you like one egg that's scrambled in a bowl with a little bit of radioactive dye that you can't taste, but it's just so that they can see it on scans. And they'll give you a couple of pieces of bread or toast and a drink of water. If you can't manage that, then sometimes they'll give you porridge if you want something softer. Obviously, they'll ask you to eat as much as you possibly can, and then they will give you a series of 6 scans over 4 hours, or as long as over a certain period, depending on how long it takes you to see a 95% decrease of food in your stomach. So anyway, that's a basically overview of what happens. For me personally, even at the 4-hour scan mark, I still had around 30% of food left in my stomach, just from a very small amount of food that I ate. And that means that I have severe gastroparesis. So, but one thing that I wanted to discuss with you guys is something called the body mass index. Now, the body mass index, or the BMI for short, is something that has been around for centuries. Now, the BMI, a little history lesson, a BMI was set up by a guy called Lambert Quetelet in the 1830s. Lambert was a mathematician and astrologist. He loved numbers and basically wanted to have an idea of a population of roughly how much on a medium range of how much a average human being would range between. So you've probably heard, if you've been in school, you've probably heard of the mode, median, range, and there's another one I'm forgetting. I apologize. So there's a mode, median, mean, range, all that. Basically, Lambert basically did the same type of thing, and he wanted to get some sort of guideline of what was somebody who weighed quite less and what was somebody who weighed quite high, and he came up with a baseline of a BMI, which he called the body mass index, ranging between 18.5 for somebody who was quite low in weight to 27.8 for somebody who was a little bit heavier. Now, he went from an average population of people in the 1830s, and obviously there was a lot of different things happening in the 1830s. There was people who were low in stature, they were dying of different diseases, they didn't have access to clean water, adequate food. You know, things were a lot different back then. And I don't even think there was many multiracial people around in the 1830s. I could be wrong. I'm not a huge history buff, but I can't honestly think that they would have included a lot of multiracial people within that. However, they do expect other races to go off our BMI scale, or off Lambert's BMI scale, not ours, but off Lambert's BMI scale, which could be wrong. I don't know, because I don't know how many people or who he basically tested for his theory. Now, bear in mind, Lambert, like I said, was a mathematician and an astrologist. He was not a doctor. He was not a physician. However, for some bizarre reason, despite the fact that this has been going around now for going on 300 years, the medical professionals still use the body mass index that Lambert created today. The only difference is that in 1998, the World Health Organization teamed up with America, because America is one of many countries that have a high rate of obesity. They teamed up with America and decided to lower the higher rate of the BMI that Lambert created from 27.8 down to 25. Now, as you can imagine, this made a lot more people who probably had a BMI between 25 and 27.8 be classed as overweight. Now, I know that they did it probably to tackle obesity and tackle people who were overweight, but there was no real reason, really, for them to lower that number, because 27.8 is like, what, 2 points? It's not even that much. So I don't understand why they lowered it, but they did what they did in 1998. But that is the only time that the BMI has ever been looked at, has ever been changed. And the BMI does not factor in things like body mass for bone density, water weight, blood volume, cell volume, or anything like that. It doesn't factor in muscle, doesn't factor in bone, doesn't factor in liquids, doesn't factor in anything, you know what I mean? Doesn't factor in genetics, doesn't factor in medication factors, doesn't factor a lot of things. Now, there has been call for the BMI to be completely scrapped and not replaced with anything. Now, for people like myself who, when I first started with my stomach causing me a lot of problems, my BMI was around 35, 36. You know, I was borderline in the obese category. I was extremely overweight, and I got treated appallingly by doctors. I'd have endoscopies because I was getting a lot of pain, and I'd be told by doctors like, oh, you're only fat because you eat a load of takeaways. You know what I mean? Chances are all your problems down to constipation. You know, it's all, you know, basically it's just being fobbed off. And I wasn't allowed to speak. It was a case of, before you even tell me that you know, it's because you've had kids or whatever, don't tell me, spin me a line. I know for a fact it's because you do this. That is an appalling way to speak to a patient, by the way. And I remember leaving that endoscopy really upset. And the nurses were like, I'm really sorry that the doctor spoke to you that way. He should never have spoken to you that way. I was like, I barely eat anything. Like, I honestly don't know why I'm as big as I am. And it wasn't until I met my birth mother, many years ago now, but when I first met my birth mother when I was a child was around 5 foot tall, super skinny, like super skinny. And when I met her a few years ago, I'm talking like 12, 13 odd years ago, you know, you're talking like she was quite a big woman, and I was like, oh my God, like I would never have considered her to be this big, because I always have pictures of her being super skinny. As you know, I'm adopted, so I didn't grow up with my birth mum. So when I first saw her, after, like, I'd not seen her since I was 3. So, you know, when I first saw her, I was gobsmacked by like how big she'd actually got. So there was obviously a genetic factor there of why I struggled to lose weight, and I did not know what that was. My father, my birth father, was also quite a big guy. I remember him being quite a big guy when I was a kid. So again, genetic factors roll into place. And it wasn't until I started digging into a lot of my birth medical history that I realised that a ton of my father's side of the family have diabetes, which is usually often associated with weight gain, or weight issues in particular. They had a lot of cardiac related issues on their side of the family, on both sides, which again is usually considered as part of being a weight related thing, especially in the medical profession. And obviously we have EDS in the family, which obviously gives you a higher rate of getting things like osteoarthritis, osteoporosis, rheumatoid arthritis, and all of those things really early on in your life. So it makes exercise extremely difficult. And obviously pain medications and things like that also have a habit of putting weight on you. And with heart medications, they also have a habit of making you retain water weight and things like that, because I know my heart medication, and I'm not on beta blockers, but my heart medication makes my ankles swell up. And if I'm on any other medication that can interact with that heart medication, that too can have an adverse effect on how much water my body retains. Now, I did not know all this at the time, and I've been told multiple times by my doctors that I need to limit the stress in my life because of my heart condition and everything else. But we all know that high stress levels can cause high cortisol levels, and there is a blood test that you can have that checks your cortisol, but there's also a blood test that coincides with cortisol levels. And if it's classed as extremely low, then chances are your cortisol is extremely high. And mine was 0.0, which is the lowest you can get. Which basically will probably stand for my cortisol levels are probably higher than they should be, which is understandable given everything that I have to live with, you know, given the fact that I have health conditions and I'm a single mum to 3 kids and things like that. So, you know, there is a lot of stress in my life, and I stress about the smallest, stupidest things as well. I'm always worrying about something, and I find it very hard to get any time to myself. So that also doesn't have a factor. But like I said, the BMI does not factor in genetics. It doesn't factor in medication, doesn't factor in bone mass, doesn't factor in muscle mass, doesn't factor in water weight, blood volume, anything. But yeah, when I first started getting sick with my stomach a couple of years ago, all my doctors kept on saying to me was, oh, it's probably just constipation. You know, maybe if you lost some weight, you know, you'll be fine. You really need to think about getting this BMI down, try and limit your stress, try and do this, try and do that. And I was getting really frustrated. They must have put me on, I think it was about 12 or 14 different types of laxative. And every time they put me on a laxative, it set my IBS off, but my weight never changed. It was literally not changing. Then I started getting really, really poorly with my stomach. The pain was getting so intense. I was starting to be sick a lot. And I kept on going to the doctor saying, I'm not constipated. I swear down, it is not constipation. I'm going regularly. I don't understand what's going on. I'm starting to become very nauseous, which is not helpful because it's obviously, you know, going to the other side of things. Something else is wrong. And it took multiple appointments before my doctor actually listened to me. And he only listened to me because I sent him a letter. Now, by this point, he'd started me on antiemetics, prokinetic medication. Now, in one of the medications, I actually put a stone of weight onto me. So I'd already lost a stone of weight because of how ill I was. And my weight had started dropping, which I was happy about, but they weren't. So my GP referred me back to the gastros and said, there's got to be something going on here because she's not actively trying to lose weight. She's just lost over a stone of weight and we don't understand why. They then looked into me and was like, give us all your symptoms again. Again, they tried a few laxatives and I explained to them it wasn't that. And then they decided to give me the prokinetic and antiemetic medications. I put on a stone of weight. So I started off with all of my problems. My weight was around almost 14 stone. I was around 13 stone 13, and I'd gone down to 12 stone 12 by the time I started on this medication. I was 12 stone 6, and I kept on losing weight. When I went on this medication, I went from 12 stone 6 to 13 stone 6 within, I think it was about 3 weeks. And I was getting annoyed because the more medication I was taking, the more my weight went up. And I went and spoke to my GP about it, and they was like, you need to come off that medication and see what happens. It was also setting my heart back off, and I wasn't very happy about it. So I came off the medication, told my gastric doctor that I'd come off my medication, and explained that it put over a stone of weight on me, and that it was starting to cause my heart to problems, and that my GP had told me to come off it. Within a week of coming off this medication, my weight had dropped back down to 12 stone 6. Now, when I went to speak to a different gastric doctor over the phone with regards to feeding tubes, because obviously I tried a lot of things previous to this, I explained about this weight that I had. By this point, I was like around 12 stone 2 or something, between 12 stone and 12 stone 2. So I'd still continue to lose weight despite all of my efforts and trying all of these medications and dietary changes and everything. Then I spoke to another gastric doctor, and I explained how I'd lost around 12 kilos in total, if not more. And he was like, you really definitely need to have this feeding tube. I'm going to speak to your gastric doctor, explain it all, make sure that you get this fitted. And my gastric doctor basically said that I hadn't lost that much weight. And the reason for that is because I'd not gone to clinic to him when I'd gained that weight and lost that weight. So he didn't put that into any type of factor whatsoever. And even though my GP knew about it. So he basically made out that I hadn't lost as much weight as I'd said, and that, you know, this, that and the other. So I kicked off at my gastric doctor and I said, you forgot that I'd gained a stone of weight and then lost that stone of weight after I came off that medication you asked me to try. And he went, oh yeah, I forgot about that. I didn't factor that in. And I said, well, I did. That's why I said I'd lost so much weight. He apologised, put it right. And then obviously I'd had my gastric emptying studies and everything. My gastric emptying study was messed up by the hospital. It came back normal originally, even though I'd been told it was delayed. So I asked them to relook into it, and then I got the right results back. I'd also been diagnosed with other digestive issues as well on top of that. So my gastric doctor reluctantly fitted my tube anyway last year. And I was told that if it kept me stable, then they'd look at a more permanent solution. But instead, my gastric doctor decided, oh, well, you know, she's still quite big on weight. So what we'll do is if it stabilises her, we'll take her off the feeding tube again and see what happens. And I went from 12 stone 3, I think I was at the time. I went from 12 stone 3 to 11 stones something. I can't remember what it was. And I was happy to lose the weight because obviously it lowers my BMI and everything's fine. But I was happy to lose the weight, but obviously my doctors weren't. And I lost over 5% of body weight and practically all of my muscle mass. And that's when they started weighing me on the composition scale to figure out how much I actually weighed for fat, muscle, bone, everything. And the composition scale is great because it doesn't take your BMI for face value for what you weigh on a scale. It will weigh you as on a scale. It basically works as a scale, but instead of weighing you as an overall weight, it will break down your weight into how much of your weight is bone, how much of your weight is muscle, how much of your weight is fat, how much of your weight has water in it, how much cell volume is blood volume, how much cell volume has water in it, how much muscle in your body has water in it. It breaks everything down into components, so that way they can see an overall picture of how well you are doing. Now, my body weight for fat is around 15 to 17%. So only 15 to 17% of my whole body is of fat. The rest of me is bone, water, blood, and so forth, majority of it being water. But my BMI is now 29, and when it started off at around 36. So I've lost quite a lot of weight from having gastroparesis. I've tried absolutely everything. But the body mass index doesn't just affect people with gastroparesis, it affects every single person. And you're still using this to this day, despite it being almost 300 years old. They lived in a different time back then. They had little access to food and water that was clean. They were dying younger from things like the plague and other things. And yet we're supposed to go off some mathematician's scale of an a population of the 1830s, even now, that probably didn't include people from different countries into that. They basically just based it on whoever was around at the time. The same applies for blood tests. Blood testing was developed in the 1940s, in the middle of the war, when they decided they needed to give somebody a blood transfusion and they wanted to cross-type his blood in order to see whether or not they could give this guy some extra blood. And they then decided that they could see other things that were related to blood samples, and took a population of the 1940s ranging from children to adults of various ages, and basically compose a scale of what was normal between, like, what range of hemoglobin is normal from what age range to such age range and things like that. But again, people lived different lives then. They had maybe the odd corner shop, and they had markets mainly that they were going to buy food from. They had to bake their own stuff at home. They didn't have as easy access to food. They didn't have as easy access to things as we do now. And obviously people are living longer now as well than they did back then. And they also have, they've found recently, actually, there's a study going on that women now in today's society have bigger wampers, so bigger bosoms than they used to have, which again is not taken into a fact when it comes to the body mass index, because, you know, a lot of people back then, they wore different clothes, you know, they had different ways of living, and none of this has been taken into fact. Genetics has not been taken into fact. It's been a known fact for years that scientists have said that there's a genetic component to why people may gain weight easier and have trouble losing it. Cortisol levels are, you know, a factor of whether or not you can have weight on you that you struggle to lose because of stress in your life. You know, medications have a huge fact on whether you have weight on you or not. And none of this is factored in when it comes to the body mass index. So if you yourself have been mistreated like I have and many others have when it comes to the body mass index, and you feel that it should be scrapped, then message me below and let me know your thoughts and what happened. I finally got treated a little bit better once my BMI had started to drop, and they got this composition scale into our hospital. It's probably one of the good things it has about it going for it. But it shouldn't get to that point, because something like gastroparesis does not discriminate. It can affect anyone. It can affect any person, whether they're white or multiracial. It can affect any age. It can affect any size. You don't have to be super skinny and malnourished to have gastroparesis. It can affect anyone. It does not discriminate. And this is one of the misconceptions of gastroparesis, is that you have to be completely falling off the BMI scale and be completely under 18.5 on it and be totally malnourished with all of your bloods and everything in order to have gastroparesis. And that is false information, because you could have gastroparesis and be 20 stone. It's just something that happens and nobody knows why. And like I said, one of the leading causes of gastroparesis is diabetes, and majority of people with diabetes are usually bigger in weight, not smaller in weight. Of course, it depends on what type of diabetes you have, but again, not everybody with diabetes will get gastroparesis. Not everybody with EDS will get gastroparesis. Not everybody with a damaged vagus nerve will get gastroparesis. Not everybody with gastroparesis will need a feeding tube, because they'll be able to find something that helps. I unfortunately have a lot of other health conditions, which means I can't try any of the red label medications, but if I could, I would. But unfortunately, I'm not allowed to, because it would set my heart into such an abnormal arrhythmia that it would probably cause more damage. And my heart's been damaged enough with the cardiac ablation I had, which you'll probably find in my previous video that I talked about. But yeah, if you have any issues whatsoever with the BMI and feel like a lot of other people that it should be scrapped, then please let me know below, because like I said, you could have two people, one super muscular and an athlete, and the other one being somebody like me who is a little bit more portly, with both of us with a BMI of 29, and yet the person who's the athlete, who's super skinny, will probably be treated with a little bit more dignity than somebody who, like myself, has a little bit more flab on them than muscle. You know what I mean? And that is not fair. That's discrimination, and everybody should be treated differently. You know, Shonda Wilson, who plays Bailey in Grey's Anatomy, put this on really perfectly and said to the surgeon when somebody came in with drop foot and was basically picked on for the fact that they couldn't exercise because of the weight, and it turned out that they had drop foot, she basically turned around and said about the BMI and how it you know, it doesn't factor in certain things. But she also turned around and said that doctors should be seeing the patient as an overall thing, not just looking at one small element of them being a little bit more chubbier around the middle and not taking them seriously because of that. They should be basically taking the time to listen to patients, taking everything at face value before they make a decision, and run the tests to make sure there's nothing that they're missing. They shouldn't just dismiss them and kick them out the door, because there could be something seriously wrong. Had I have not kept on pushing and pushing and pushing at my doctors to state that there was something wrong and that what they were giving me as medication was not working, I would never have received my gastric emptying study. I would never have spoken to several doctors. I would never have had several MDT meetings created with me in mind, so that I wouldn't have my feeding tube by now. I'd still be struggling, and I'd probably be in a worse state now than what I could have been had I have not pushed and advocated for myself, because I wouldn't allow them to just take off me the fact that I had a BMI of that was higher than what they would class as normal. So like I said, if you've had issues with the BMI and you are in the same situation, whether you're at the start of your gastroparesis journey or not, and you're further along but you're still having issues with doctors with regards to them not listening to you because of your BMI, then message me below. No, you're not alone. I'm here to help. And yeah, I hope you enjoyed watching this. I hope I've given you a little bit of insight. And yeah, let me know your thoughts about it. So thank you for watching. Thank you for your support as always. I hope you have a lovely weekend, and I will speak to you again soon. And don't forget to subscribe for more updates. Bye.